Kicks 105, good morning. It's the Merrell in the Morning Show. And now joining us from CHI St. Luke's Health Memorial, we have the Market President and CEO, Monte Bostwick, as well as Mary Franklin, who is the Market Senior Vice President of Patient Care Services there at St. Luke's Health Memorial in Lufkin. Thank you so much for joining us this morning.
Pleasure to be with you.
Thank you.
Sure. So let's go ahead and jump right into this. And, with the opening on Monday that we just had, let's go ahead and talk about St. Luke Health Memorial's commitment to enhancing women's services.
Yeah, the commitment to women's services really was founded in our board of directors, Danny. It certainly predated me. Going back both with our existing board members and many which aren't even on the board anymore. I can remember whenever I was looking at this opportunity to lead this facility, and this is over 4 years ago now, that this was very much a topic of discussion for them, a commitment that they had, and that was one of the things that drew me into this position, is to see the engagement that they had around women's services. And it wasn't just them. Certainly, there were others that were coming along in the partnership to show their commitment. We had a number of philanthropic foundations, et cetera, especially the Temple Foundation that came alongside with us in this, and they were also a part of that. So the commitment has been longstanding.
Millions of dollars have been put into this state-of-the-art facility. And what role do aesthetics play as far as this healing process is concerned?
Aesthetics are always important. I would tell you that the foundation for us is really about safety and providing a safe environment for our patients so that healing process, or in this case, both in the delivery and if needed, the NICU, that those areas are comfortable, they're clean. And I think having an environment that one can relax in, that is welcoming to family and friends, is certainly a key component to that healing process.
It's been a great road ever since this started. It kind of has a spark some 8 years ago, and now to see where we are today. What has been the reaction from the staff of this particular project?
Yeah, I think it's been great. I was going to ask Mary to weigh in on that as well. So
I think the staff has the wow factor. This is such a great thing for us here at this facility and for our market in general. They are excited about everything that has been going on, and they're anxious to see more growth.
And, growth and awards, those are things that come year after year to St. Luke's Health Memorial, and a lot of that has to do with the staff. So let's talk about the staff there, because they really deserve to be bragged about.
They do. We have a large group of seasoned nursing staff here, and we have young nursing staff coming on, and they're being trained and grown up in this facility also. We have a lot of certifications going on right now because the nursing staff really want to be top-notch in what they're doing, providing the best patient care ever. I tell them all the time, they are the shining stars of Deep East Texas, and they provide that compassionate, caring attitude, and they surely are those bright and shining stars. I'm very proud of them.
2020 has been such a tough year for so many. It's great to have some great news like this. I'm sure the staff really enjoy that. Now, of course, we've talked a lot over the course of the past hour or so about the partnership with Texas Children's Hospital. Why is it so important to have this partnership as opposed to other hospitals who may have similar benefits?
That's a good question. Texas Children's Hospital is one of the top children's hospitals, not just in Texas, but in the entire country. I think the most recent U.S. News and World Report had them ranked as number 4 in the country. So that's a pretty good starting spot for us. But I would tell you also that we had a number of partnerships already in existence with Texas Children's through other sister facilities of ours throughout our Texas division. In addition to that, we also were able to partner with them even before the NICU and the Women's Center got started through our maternal fetal medicine program. And so they're partners with us in that. So at the end of the day, they were known entities to us, obviously, just their brand and who they are as an institution spoke to us. And then we just had the same type of vision for the kind of care that we wanted to provide for our communities here in Deep East Texas.
Yeah, their reputation certainly does precede them. So who all is involved in making women's services successful here?
Well, I guess I would go back to it starts with the board. That leadership and their commitment is the vision that's needed and necessary in order to create the buy-in for everybody else. And that goes all the way to our physicians who are highly engaged and committed to quality and outcomes and taking care of our community. Mary mentioned our staff and the compassion that they show every single day. And then again, it takes everybody involved. And I mentioned the Temple Foundation, the Grum Foundation, others, our own board members committed monetarily to these projects as well. So it takes a village to make something like this work.
Oftentimes in conversations with folks there at CHI St. Luke's Health Memorial or on the website, you hear the term family-centered care a lot. Can you expand on what family-centered care is all about?
Sure, I can. Family-centered care is just that. We focus on the family as a unit, and that is the importance of getting information to them to help them when they do go home with that infant to have the best outcomes possible. So it's participation from all entities, it's collaboration, info sharing, and it's family friendly. So we do focus as a group on that, and a lot of people give them info, and then we have transition rooms to help them transition with the baby so that when they do go home, they have that understanding of how to take care of the baby.
And why is it so important to have this level of care in East Texas, and how does that play into the regional hub that we are?
The counties that we serve here at St. Luke's Health Memorial, we have three of the more challenging counties relative to health outcomes in all of Texas. And so the opportunity to bring this level of care much, much closer to home is really exciting, and it's really important. And as you noted, it's just accretive to the other strategies that we work to deploy to do that exact same thing, whether it be through our award-winning cardiac programs and stroke certifications and those types of things, where we're doing all that we can to continue to develop what we are needed for our communities here in East Texas.
I can only imagine it takes a special kind of person full of patience and love and professionalism to work in a NICU. So can you kind of give us what the environment is like there?
I did work in a NICU at one point in my career, so I do know that you have to have a love for that. There is nothing more precious or tender than a brand new baby, and especially one that's very vulnerable. And so that compassion and love is felt throughout that unit. And we have so much work to do with mothers so that they understand what we're trying to do, and all that we can do and provide for them helps them to understand how to also take care of that baby. It's one of teamwork. It's one of compassion and caring, and it's a care coordination team effort. We do have a care coordination team that is provided with a neonatologist, of course, the parents, case management, social workers. We have resources through Texas Children to help them prepare in any way possible for the transition to home. We have very educated nurses and certified nurses that can help them also. So we do have a lot of resources available, and we will lend to those resources when we need those.
Why should somebody choose the NICU there at St. Luke's Health Memorial?
Well, we have individual rooms where parents can stay, so it's not just like a pod of beds there, so that we do have individual rooms for those parents that they're able to participate in that care. We also transition that baby out with them to make sure that they can go home. The baby can gain weight and go home and do fine. Those are the types of things that we support for them.
Why would you suggest that folks choose St. Luke's Health Memorial?
Well, as you noted, healthcare choices are very important to people. And what I see our responsibility in is providing that environment and access to the technology, to the physicians, the nurses, such that we can optimize those outcomes and make it something special for them. We may not be chosen every time. In fact, we won't be. But our goal is to make sure that that's there and available for our patients and their family, and that they'll choose us not just for this, but for other healthcare needs as well.
Now, I know we're kind of in a really strange situation, but do you provide tours of this Women's Center or not?
Yes, we do, and you can call 936-639-7977, and we will set those tours up for you.
This is a huge state-of-the-art Women's Center now there at St. Luke's Health Memorial. So what's next? How do you improve upon this?
Well, we do that every day as far as looking for what's next for us. And, Danny, I would tell you, we are working on a couple of things that I think are going to be very impactful for our community here in East Texas. I'm not quite ready to share that with you, but I promise you when that time comes, I'm going to be happy to get back on the phone with you and share with you and the audience about where we're taking the next steps in healthcare and East Texas here. So looking forward to that.
I mean, it must be an exciting time not only to be in the position that you're in to see all these changes come about for the better, and of course, the main goal here to service the community of East Texas, but just to be a part of it, to see these technological advancements, and to see your staff's reaction. It really must be something special.
It really is. I couldn't be more happy with what we've been able to accomplish over these last several years. Again, I want to thank our board of directors, the Temple Foundation, Grum Foundation, our staff, our physicians. Again, it's just taken the entire team, and I'm tremendously excited about what our future holds.
Anything else you'd like to add about the Women's Center, or just anything in general?
Not that I have today. I also would note that we're also going to have a video tours available. So if somebody didn't feel comfortable necessarily getting out and coming up for an in-person tour, soon we'll have a video tour available up on our website that they could go there and check it out as well.
Very good. Monte and Mary, thank you so much for joining us today.
Thank you.
Thank you so much.